And amid the coronavirus pandemic, we're still dealing with a health crisis. This has been ongoing for years, and that's the opioid pandemic. Our own Kelsey Anderson is joining us live this morning with how one local doctor is working to combat it. Kelsey, good morning.
Hey, good morning, Lauren. So according to the CDC, the amount of prescription opioids that have been prescribed yearly have been decreasing for the last 12 years. But that does not mean that Americans are still becoming addicted to these opioids and possibly overdosing. And I spoke to one doctor who says it's up to physicians to be the first line of defense to combat this.
My bicep, I had surgery on here, and then my labrum, he also replaced, which is here on the backside more.
Zach Martin had shoulder surgery about 4 weeks ago.
Motion's good.
Feeling amazing, honestly.
Pain's better.
Yeah. Pain's never been there.
He tells me he visited Dr. Brian Badman after having constant discomfort in his arm. And to his surprise, there wasn't much pain post-surgery.
My recovery has been awesome ever since. I've never had any real pain.
Saying he only needed to take pain medication for 1 day, and even then, it was just as a precaution.
I would never say there was any real pain to this.
Dr. Badman tells me that's because of a fairly new drug he uses during surgery called Exparol.
We showed that at 3 days, patients with Exparol block took on average about 9 less pain pills, which if you hear 9 less pain pills, you don't think that's a lot.
But Badman says it takes just 8 days for someone to become addicted to opioids. So 9 pills is significant to about 3 days without the drug.
I think it's huge. I mean, it's something we as clinicians, we need to do our part, because I think we partly contributed to some of the crisis that we're currently experiencing, and so we as physicians need to do something to lessen that burden.
As for Martin, he says he's glad his surgeon is working to ease the opioid crisis.
I think it's awesome. I mean, I think it's great to definitely help for the overuse, people getting addicted to these drugs. With the medicine they used for me during the surgery, I mean, this is a good way to combat that and start knocking out the drug use.
Dr. Badman says he takes more steps pre and post surgery to kind of combat this by talking to his patients and being very honest that they're going to have some discomfort after surgery, but that does not mean they need to take those pain pills, only if they are in extreme pain. Reporting live, Kelsey Anderson, WRTV.